Hello and welcome to Supplemental Health Care's Insight series. My name is Alex Acton. I am the Vice President of Marketing and Communication here at Supplemental Health Care. I'm going to be your host as we sit down with industry leaders and experts to discuss some of the challenges facing workforce planning and execution in the market today. To kick us off, we're going to be sitting down with industry veteran Scott Armstrong to discuss some trends in labor supply and demand, as well as some systematic challenges that are facing healthcare planning across the United States. Let's get started. Thank you so much for joining me today, Scott. So, by way of an introduction for our listeners at home, I want to introduce everybody to Scott Armstrong. He is the Chief Revenue Officer here at Supplemental Health Care. And I think, you've got probably 18 years-ish at this point of experience in workforce planning and solutions across healthcare. So I think you've got some on-the-ground experience with this healthcare crunch that everybody is feeling. And I think we're really excited to hear what you have to say today. So welcome in.
Thanks, Alex. Appreciate it.
All right. So before we get in, we want to talk a little bit about some different elements of how systems across the United States are feeling the pinch in healthcare planning and hiring and everything kind of labor related. But before we get there, just from your vantage point, because you're obviously having a lot of conversations about this every day, what's the landscape out there for kind of workforce planning and strategy across the United States from your perspective?
Yeah, just that topic, huh? Nothing too complicated today.
It's our first show, you know?
Exactly. No, I mean, obviously, there's been a lot of change in our industry over the last 18 years that I've been fortunate enough to work in this space. I think most recently, not that it always wasn't a consideration, but the thing that's top of mind is really just cost. Our healthcare partners and healthcare executives and health systems across the country are experiencing more pressure than ever when it comes to just managing the dollars and cents and the margin pressures and everything that comes with that. And with that, they're trying to find the most creative ways to balance their extreme cost centers, and one of those happens to be staffing. Right, that's generally one of the highest spend items for any healthcare system, no matter where you look and no matter what setting they might exist in. And so that is the topic of the day. People are wanting to see more advanced solutions. They really want real partnerships, not just placements and things like that. It's just evolved beyond that, where people are wanting to work more together as opposed to just this is kind of a separate thing that sits off on the side. It's more, how do we fit this into the general ecosystem of everything that we're trying to accomplish?
Yeah, absolutely. And I think, as you say, uh, this has kind of been the banner at every trade show and industry publication for going on 10 years. And I obviously, hopefully, we're going to get some insights today. I don't know we're going to solve the problem, but as we think through where that's really coming from, I think there's really the two sides of the equation. We know that demand for healthcare services is increasing, and then there's obviously the question of where is that supply going to come from. Before we finish today, we want to talk a little bit about there's some real systemic challenges, just the way that we deliver care that are creating complications for that as well. To get started, I'm just going to throw some numbers out there because every time I look into these, they're staggering. And anybody who finds this conversation interesting has been living these numbers, I'm sure, over the last few years. But Americans over the age of 65 consume about 2.5 times what a working age adult in the United States would on healthcare. So most of the care is going to this older population that we just see growing very rapidly. The estimates are that there's about 11,000 Americans turning 65 every day for the rest of this year and through all of 2027, where we're going to hit what they're calling peak 65. So this is where our population really starts to age and that demand just keeps increasing. With that being true, with the demand set to rise even more as we go over the next couple of years, how should health systems be thinking differently about their workforce planning over the next, 3 or 5 or 10 years to navigate that?
Yeah, I mean, I guess the good news is we're living longer, right, as a population, and that's obviously good for humanity in general, but it does create some complication and some complexity that our healthcare environment and our healthcare structure has to really adapt to. And so, I think really it's trying to find the balance of different ways that people can access care, and just being open-minded in that, and looking at the balance of virtual options and home health care, and different ways that people can get the services that they need without necessarily having to come directly into the hospital for different things, or go to their doctor in a doctor's office setting for the healthcare needs that they have. And I think everybody in our world is looking for more flexibility. You think about that in terms of our talent and just the overall workforce, specifically in the United States. People want more flexibility in the way that they can approach work. And I think the same applies to the way that we as healthcare seekers are looking to have access to healthcare, as we want to see more flexibility in that. And so I think, health systems are constantly trying to sharpen the pencil on that. They're trying to figure out more ways to do virtual things. Obviously, there's a lot more going on in the world of behavioral health and mental health than there ever has been, really in our country's existence, where that's just become something that's a part of your overall health, as opposed to maybe something you keep quiet and hide in a closet somewhere. And I think that is just a wonderful thing. And so, but it does create complexity, to your point. I think the healthcare systems that have that the most dialed in are being very, very strategic in that, and they're opening as many doors, making investments, and kind of spreading that out across different ways, as opposed to just saying, well, this is where you can get healthcare, and we don't have much to offer beyond that. So again, very complicated topic. It is great that we are living longer, but at the same time, you have to be in tune with that and in lockstep with that, to make sure that we're moving, and that we're moving at the pace of of the industry and of the people who want to consume healthcare.
Yeah, absolutely. And I think that's, one of the things that I think we've seen a lot given our the way that we supplemental healthcare have kind of approached this problem of specializing in each one of these categories and having, really dedicated resources through ambulatory networks and clinics and home health and, as you mentioned, mental health and behavioral health, is that, as systems try to become more flexible at how they're offering care through different networks, the demand for specialized skills. There's some numbers that we saw that there's about an expected 20% increase per year in robotic surgery demand. The number of imaging needs that are increasing. There was an estimate that we saw a 45% increase over the next 20 to 30 years in CT imaging needs, 80, 90% of that being driven by an aging population. I think when we hear from clients, a lot of times there's a lot of interest right now in how do we provide more imaging and radiology support. That's absolutely so true as we see healthcare delivery evolving. Obviously, the workforce planning has got to become even more sophisticated because you got more roles and more places trying to be delivered through more sites of care. It's going to be an interesting thing to navigate. Let's talk about on top of that. So we need more skills through all of that. One of the things everybody's nervous about is what's that going to cost? And I know when we look at breakdowns for a lot of health systems, it's not just that labor costs are increasing. Labor is maybe half of what a health system has to plan for, but they're seeing pretty much throughout their supply chain, medical devices, drug costs are increasing dramatically over the last couple of years in a few categories. So how are systems sort of planning ahead to navigate labor costs might increase, but you've got some other categories going up too that we're going to have to build a strategy to make sure that they don't get overwhelmed by any of these individual costs. What's the roadmap for that?
Yeah, I mean, I think a microcosm of that is we all feel that in our own personal household budgets, right? I mean, inflation is a real thing, and it's impacted businesses, it's impacted healthcare, it's impacted obviously us at the individual level and at the family level. And so, I think what we're seeing as the most effective strategy is obviously having data and having insights that show you very clearly and give transparency into the whole landscape of all of those items from a healthcare perspective, but also selecting the right partners that can come alongside you strategically and provide really industry level and market specific insights around those particular items. Because it's impossible to be the master of all things, especially with as many routes and avenues that healthcare tends to go down. And so, by aligning with the right partners and bringing on those strategic relationships, and again, kind of back to the original question, but aligning yourself as true partners with your healthcare systems and being able to come alongside them, share information, be thought partners, and strategize around the right dynamic and the right way to attack each one of those items, as opposed to, again, just looking at it as, well, maybe, okay, we'll deal with the staffing thing. We have a partner for that. Let's talk about it. Let's talk about how we can get more sophisticated. Let's talk about how we can add more resources, more solutions. Let's talk about how we can bring in lower cost items first, maximize and squeeze the blood out of that particular entity, and then start moving into the more expensive items instead of just traditionally jumping to most expensive items. And so I think solution design and really just being very strategic in the sense of not only the understanding of each one of those cost centers and buckets, but then the partnerships that you're aligned with, where maybe the internal resources and the internal skill sets just can't quite take you as far as you'd hope they could.
Yeah. Well, and I think that's a great segue into sort of the next piece of the conversation here is we talked a little bit about demand is increasing. A lot of what's driving that strategy is that the supply isn't necessarily like getting bigger. If there was infinite supply of the skills that we needed, we wouldn't be having this conversation. We wouldn't be feeling this pain. But the reality is that there's some numbers that we've seen varying levels, but generally speaking, the number I trust is that about 80,000 qualified BSN applicants got rejected from nursing schools in 2024 because there weren't faculty. The number of faculty vacancies at a lot of our nursing schools and medical schools for doctors continues to rise. We don't have enough faculty. We don't have a pipeline for faculty to educate these folks. I know all of that is creating a lot of stress on the system. And then you add in the numbers that have kind of bounced around in the COVID years, but from the National Council for the State Boards of Nursing, their estimate was that about 40% of nurses working today intend to retire by 2029, which at this point, that's not that far away. That puts a lot of stress. That's 1.6 million nurses that might be leaving the workforce. In light of something like that, how important, talk about thinking strategically, does not just filling new roles, but thinking about your current core staff and retention and well-being, how important does that become to the strategy?
Oh, I think it's massive. And I was at a state hospital association conference about a year ago now, and you always hear about the nursing pipeline and the aging age of the nurses and the so many that are approaching retirement, like you mentioned. But then actually the conversation was flipped a bit, and they said it's not so much the pipeline as the pipe, because to your point, there's people not
Hmm.
even getting into nursing schools who are qualified because of the resources or nursing school closures across the country. And so I think that's a huge thing. And we've seen where almost every, well, I shouldn't say every, but a lot of the healthcare systems that we work with are partnered with some kind of nursing school or some kind of university program where they have sort of that new graduate, kind of migration that then helps fill their gaps as that natural attrition happens with retirements and people aging out and that sort of thing. And so I think that stuff is huge. And we've tried to be creative in the way that we partner with our clients so that we're supporting those initiatives, even at the grassroots level with their new grads and finding ways to help strategically and also at times financially with those nursing schools and getting them more resources, more information, more data to make them be as efficient as they possibly can be. But, like you said, that is the biggest challenge, and it really always has been. And so I think there's, thinking about, we see health systems thinking about that differently. How can we extend the career of those individuals that might be approaching retirement? Can we put them into maybe a role where they're not on their feet as much, or maybe a role where they can work remotely but still have a major impact on that particular unit or department that they're leaving? And just trying to find ways to give people, kind of back to that whole point of flexibility, giving people more flexibility, leaning on their knowledge, because not only is it the actual body and the hours that are being worked by that individual, but when you're losing people of that kind of tenure and experience who have been through the ups and downs of healthcare, and they've got the war wounds and the scar tissue, and they're kind of the hardened war vets, so to speak. There's a lot of value that's then passed down to newer clinicians as they're coming into the workforce, to help them better themselves and to just deliver a better early stage education and orientation process for them. And so you see organizations all throughout the country leaning into that and trying to find ways to extend the life cycle of those individuals who may be considering retirement. And that's been tremendously valuable. You've also seen an enormous shift, especially coming out of the pandemic, where hospitals have really rebranded, healthcare systems have rebranded their internal processes, and tried to become much more in tune with retention strategies, much more intentional about how they're checking in and following the early stage progress of a new hire, and making sure that they're comfortable, they feel safe in their work environment, they feel that they've got great resources around them, that they have great check-in points, and just really beefing up that overall orientation process. And I think you've seen that be very successful, with more people feeling comfortable at work and looking to stay long term at the facilities where they've started. And I think hospital systems deserve a lot of credit for that, and really, kind of going back to the, I don't know what the right word is, but just going back and rethinking to reinvent that overall
Yeah.
process, and really to set themselves up early for better retention results and outcomes.
Yeah, absolutely. I mean, I think that it's true innovation. We kind of we peg innovation to technology a lot of times, but it's just that willingness to rethink the way that we are interacting and planning and iterating. There have been some great results that have come out. There was one we were looking at not too long ago. A health system had some of their older nurses doing kind of virtual coaching for some of their
Yes.
youngest staff. And what they found is that nurses that were able to consult somebody over an iPad were much more willing to ask for help than if they had, a preceptor standing over their shoulder, watching them. That was a human dynamic that meant that the younger nurse got more support and was able to leverage that knowledge when they needed it. So rethinking the way that we've done some of those programs in the past, is a great way to unlock, as you say, some of those older, really experienced, war-tried nurses that we don't want to see leave the workforce, and help that pipeline really get some of the younger folks up to speed a lot faster.
Well, I
Yeah,
think
yeah, I totally agree that innovation's so critical.
right, and like you mentioned, the robotic surgeries, and we have all this conversation around AI, and all that stuff is super important as we try to find ways to just bring efficiencies across the board in as many areas
Mhm.
as possible. But ultimately, healthcare is a people business, and no
Yeah.
amount of technology is ever going to replace that. And so I think what you've seen is kind of a return while thinking about all these innovations, and whether it's AI or different types of surgeries or different types of technologies, that still has to be on the forefront of the thought process. But you've seen kind of this return and this resurgence of investing in the human at the front end of
Mhm.
the recruitment process. And I think you have to have both of those things. We talk about our approach as being high tech and high touch, and I think that's very relevant when it comes to the healthcare staffing space, specifically with healthcare systems in general too. Because if you just focus on the tech, you kind of forget about the human. And if you focus on the human, then you're probably not finding all the efficiencies that you can within the tech. And so just finding that balance and being ever vigilant about making sure that your eyes are open to all of those things is critically important.
Yeah, absolutely. And it calls to mind of a story of sometimes you see the way that this shows up is hard to document or showcase of why this strategy is the thing. But we had a nurse that went from a large teaching hospital to a rural health system, and in her course of her care, I think she was working in an ER assignment, saw a vent that she had just been trained on at the large teaching hospital that nobody else on the floor had ever seen at this smaller system. And so she had this great body of knowledge. She was able to help the nurses around her. I think they brought in the chief of medicine, hadn't seen this event before, and it was this great transference of knowledge, as you say, like on the people level. This was, you brought in the expertise, it was in the right place at the right time, and so the high tech, this new medical technology was able to work for this patient. Obviously, life changing for them, life changing for the family, because we had the right person in the right place at the right time. So when these things come together, that personal connection to it can just be so powerful in healthcare. It's one of the things that I love working in this industry, but that's absolutely how it's all realized when it comes together. Um,
Absolutely.
good to get to be able to share those stories when we can get them. So we talked demand increasing. We talked supply is going to be difficult. Obviously, the retention is super important. I'd be remiss if we didn't talk about some of the other kind of systematic challenges that we see facing healthcare. workforce planning and delivery right now. And throw out a couple more numbers. So you mentioned margins earlier. I just brought up some of the rural systems. What we see a lot of times is the rural systems right now are facing some of the tightest budget crunches. There were some estimates that in 2025, the average or the median rural hospital operated at about a 2% margin. There were about 40% of them that were basically operating at a loss for the year. Their populations tend to be a little bit older. They tend to rely on Medicare and some of these funding models a little bit more. So it changes the payer mix, which can put pressure on some of the systems. Um, how does that kind of reimbursement pressure and some of these challenges with the funding model show up in workforce decisions for health systems? And I guess especially in rural communities, but across the spectrum.
Yeah, I mean, I think the first when you hear that kind of topic come up in a conversation, no matter where you're looking at it, I think the first thing that always comes to mind to me is it's important to listen, to understand, and then to be very clear that each system faces different challenges. A rural health system is not the same as a large urban, level one trauma center, or a university, academic university medical center, whatever that might be. They're different, and their challenges are different, and you can't just peanut butter spread or broad brushstroke a solution across everybody the same way. And so I think even more so, we're kind of in that same theme, right? But even more so is really learning, understanding, getting into the weeds. That partnership piece is so critical, so that we can really dial in the right strategies, whatever it is. Obviously, we're in the healthcare staffing space as supplemental healthcare, and so that's primarily what we're focused on. But that can feel like a broad brushstroke until you actually get in. You understand there's lots of different ways that we can leverage local talent, leverage data, and different intelligence that's coming in, market insights and trends, and being able to prescribe those for in a way that's digestible for each client specifically is incredibly important. And I think where you see the most successful relationships on our side, the most successful partnerships, is where you have those type of relationships with the vendor partners that you're utilizing, and being able to have a solution that's fit for you and custom fit for you, as opposed to just something that's sort of a one size fits all off the shelf kind of approach. And obviously, again, not to restate the obvious, but rural health systems have a much different dynamic than what those larger systems do. And so you have to prescribe a little bit of a different formula in order to do that, right? They don't pull, speaking specifically to rural healthcare, they don't have the population base to pull from. When you talk about that, the pipe and the pipeline of nursing candidates, or just clinicians in different specialties, whether that be nursing or allied health, they just don't have the population. And so there might be a little bit more reliance on contingent labor in those situations, or you might have to build out a little bit more of a robust internal float pool, to make sure that we're capitalizing on everything that we can. And then, but also there's understanding that contingent labor and the old school travel nursing model is not as expensive as maybe what it felt like during the pandemic, right? We have to be very real about the data and the numbers and the financials around our current state, and not always be looking back at kind of the worst place that we all got into. And nobody wants to go back to those pandemic struggles that impacted both agencies and health systems alike. And so I think, again, really just making sure that you're under the hood, working as partners, and truly digging into the specific needs of each facility, no matter what that looks like, to make sure that you've got the right formula for success and are providing that proper level of support.
Yeah, absolutely. I think, you said at the beginning the importance of solution design and how do we really make sure that we're understanding the problems on the ground for a specific partner or system or network or however they're, set up. And then there's the geographic piece of that. And there's the long-term planning versus the short-term solutions. I know how frustrating it can be for folks. We see these numbers about our industry where some publication comes out and it says, the industry is up by 5%, down by 5%, doing whatever. And you go, well, that's not our exact experience. We're facing all of these different headwinds. We've got these internal challenges, we've got the external challenges. So to really be able to get on the ground and make sure we understand that it's not, this healthcare pinch is not one thing, but it's probably being realized hundreds of different ways by different systems and providers in different communities all over the country based on their context in their situation. And I know we've heard from a lot of our long-term clients, folks we've been working with for upwards of a decade or more, of coming in and the way we deliver in one systems is totally different to the way we deliver in another system because their challenges are so unique to them. So understanding that to really put the right solutions is so incredibly powerful.
Absolutely.
So let's try to bring it home. I know these are some big questions that obviously everybody is worried about. If you were across the table from, let's say, a health system executive who's navigating this stuff on a day-to-day basis, as they look forward to kind of their workforce planning for the next couple of years, what's your advice to them to think about the future?
Yeah, I mean, we're doing that. Fortunately, we're doing that all day, every day across the country, which is a great place to be in. And again, I think it does take exactly what you said, sitting down across from each other, really getting underneath the hood and understanding, what are the strategic initiatives for you specifically. We know kind of what the healthcare dynamics are. We've discussed a lot of those broader topics just in this dialogue and conversation that you and I are having, but that might look different to a large system in New York City as opposed to a rural system in South Dakota, and to really understand where are they seeing specific pain points, where are they seeing specific pressures, and making sure then that once you have that information, then we can come back and prescribe more of a specific solution design that makes the most sense for that particular client. Right? We've as a healthcare staffing industry, we've never been more advanced and more kind of able in our ability to drive new and innovative solutions. Gone are the days of, oh, you need a vacancy, here's a bill rate, and here we go. Right? We
Yeah.
we are looking at the broad spectrum of the recruiting model and really trying to provide more help earlier and more often in the early stage recruitment cycle. So what are we doing to help? What can we do to help with your permanent hiring? What can we do to drive attention to your open positions now before they even become anything that's considered contingent? What can we do to leverage the local talent that's in your area through per diem pools, internal resource pools, perhaps a direct sourcing model, where we can just leverage and maximize whatever hours are available to be worked earlier at a lower cost model before we get into that traditional travel model, which again is much more affordable than what it once was, as we saw things get a little out of hand. That's probably an understatement during the pandemic, but travel and contingent is much more affordable than it once was. We've seen some studies released from KPMG, which is a neutral third party that was kind of assessing our industry, and it was kind of a refresh of a study that was done in 2017 that kind of shows the fully burdened cost of an internal employee and a permanent staff member versus the cost of a contingent laborer, and those costs are actually less when you look at a contingent laborer by about 5 to 6%. And again, not saying that we want to have a health system running 100% travel. That's not at all what we're saying, right? We want to maximize in that order your perm staff, your local opportunity, and then get into the travels. But it is still a worthwhile strategy that makes sense and should be a part of anybody's overall hiring strategy and staffing model. And so, as you look at that, it's just being prescribed in the way that we deliver. We have all these things available to us. We know what our clients need, but through that understanding, through those conversations, through that learning and discovery process, we can take all of those solutions that we have and prescribe a very specific solution design that makes the most sense for each individual client that we're working with.
Yeah, absolutely. And I think, I know we all wish we had a crystal ball and we knew exactly what's ahead for us as an industry. I don't think anybody's got that figured out yet, but we do know it will almost certainly be different than the COVID years. It's going to be different than the pre-COVID years. We're going to be navigating a lot of these unknowns together. So having that nimbleness and that strategic viewpoint to really make sure we're planning and we adjust. Whatever we work on in the next year is going to be different than the year after. So that's great insight. I want to thank you for joining us today. I think we've got some great information out that we're excited to share with everybody. So thank you for being a guest. I know we've got some future topics that we're excited to talk about too. So we'll see you again soon.
Yeah, had a blast. Thanks a lot, Alex.
Thank you for joining us for this episode of Supplemental Health Care's Insight series. If you found the conversation useful, please be sure to subscribe to be notified when future episodes become available. And if you are part of a health system that found any part of this conversation too familiar, please visit www.shccares.com to learn how we can help you with workforce planning and strategy, no matter where you operate inside the United States. Thanks for watching.